Hi, this is Dr. Madhava. I am an internal medicine physician, board certified in addiction medicine, and a functional medicine practitioner. In functional medicine, we look at the root causes of symptoms and diseases. I've worked in the field of addiction medicine for a very, very long time. I've worked in an inpatient detox, inpatient rehab, outpatient opioid treatment programs, methadone programs in primary care clinics, and in the jail system in treating addictions. I am the owner of a functional medicine-based private practice for the treatment of addictions called Brain Body Medical, where we offer comprehensive and personalized treatments. Please visit my website for more information. This is the second presentation on alcoholic liver disease. The first one was on the root causes of alcohol-associated liver disease. Please watch that one first. It gives you a lot of background information for this presentation. Today, we will discuss on products that you can use to reduce the harms to the liver from the use of alcohol. Of course, the best way to reduce the harms is to stop drinking. But for those who are diagnosed with a liver condition, I feel that it's best to work with a knowledgeable provider, someone who can help you deal with the root causes of your liver disease. A functional medicine practitioner or a naturopathic doctor or a herbalist who knows about appropriate functional medicine testing and treatment would be your best ally in trying to reduce the harms to your liver from alcohol. Everyone is different, so it is best to test and then treat appropriately depending on the results of those tests. These are the root causes of alcohol-associated liver disease. We talked about all of these in the previous presentation, so please go back and listen to that presentation to understand all of these etiologies of liver disease. We know that malnutrition is very common in folks that use alcohol, and it's due to several different factors, including poor dietary intake, the quality of food that they choose to eat. Maybe they have decreased intestinal and stomach enzymes, they have decreased nutrition absorption, and perhaps they have increased excretion of the nutrients that they may absorb. So in this paper, they suggest taking a B complex vitamin with increased B1 vitamin, which is thiamine and folic acid, and a multi-mineral supplement. As I said previously, I think it's best to test and then treat appropriately. In this paper, that's what they did. They measured the blood and urine markers for oxidative stress in patients with cirrhosis. What they found was that many patients had increased lipid peroxidation levels, which indicates oxidative stress, and they had reduced antioxidant levels such as vitamin A, Ce, selenium, and glutathione. What they concluded was that antioxidant treatment would be helpful in the prevention of alcohol-induced liver injury. In this paper, they discussed giving nicotinamide riboside, which is one of the metabolites of vitamin B3. They said that when giving mice nicotinamide riboside, they found that it protected against ethanol-induced liver injuries because it increased the amount of NAD+, and that this also reduced oxidative stress and improved mitochondrial function. So it might be something that one would consider if you had a fatty liver to give NAD+. In this paper, they discussed different herbal products that could be beneficial for liver disease, alcohol-related liver disease. Here they talked about quercetin as being the most potent scavenger of reactive oxygen species, and that giving quercetin could protect the mitochondria. Curcumin, which is derived from turmeric, they found would also reduce oxidative stress by decreasing NF-kappa B activation. Silymarin, which comes from milk thistle, is also an antioxidant and anti-inflammatory. And they say that it decreases inflammation by decreasing TNF production. Betaine is a methyl donor, and they showed that it can decrease fatty inflammation, fatty liver inflammation, and fibrosis. And they showed that this fifth product, glycyrrhizin, had a protective role in preventing hepatic fibrosis and steatosis. It's important to note that many of the studies are done on animals or in vitro, but there are studies done in humans that show similar properties of protecting the liver. Schizandra is a Chinese herb, and it's been used for many centuries to treat liver conditions. It's currently been used in humans to restore liver functions in patients with hepatitis and liver dysfunction. In this paper, they used Schizandra in mice, and what they found was that it reduced oxidative stress and increased antioxidants. And with these mechanisms, it was able to reduce fatty liver that was caused by ethanol intake. In this paper, they looked at rosmarinic acid, which is an antioxidant, a polyphenol, which is found in many different plant products such as rosemary, sage, lemon balm, mint, and sweet basil. The study was done in mice, and they found that it reduced lipid accumulation and fatty acid biosynthesis, and also reduced oxidative stress from acetaldehyde. This is another Chinese herb, salvia, also called danshen, and they found that in the rat model, it inhibited fibrosis by decreasing the expression of some of these factors that stimulate collagen deposition, and thereby causing fibrosis and cirrhosis. Another study to show that silymarin, a product of milk thistle, had both anti-inflammatory and anti-fibrogenic activities on hepatic stellate cells. So these are the cells that are implicated in collagen deposition and causing fibrosis and cirrhosis. So we went through several different herbs that you can potentially use to decrease some of the liver issues from alcohol. But the fundamental thing you need to do is improve your diet, meaning start eating whole foods, reducing the amount of processed foods, decreasing the amount of sugar, and then using some of the herbal products and vitamins or minerals as needed, depending on your testing. The second most important thing to do is to look at your gut microbiome. So we talked about in the first lecture, the microbiome are a group of bacteria and different other kinds of organisms that live in the colon, that live mostly in the colon. And we know that having an imbalance of these microorganisms can lead to a disrupted, not just a disrupted gut-liver axis, but also a disrupted gut-brain axis, causing both brain and liver problems. We know that alcohol directly can cause an imbalance of the microbiome, and alcohol also directly can cause increased intestinal permeability. So what can we do about that? In this study, what they found was when they tested folks, they found, well, this was a study in mice, what they found was that there was decreased amount of Akkermansia muciniphila and Faecalibacterium prosnitzii. They are beneficial bacteria that's really needed in our gut. They were found to be decreased in mice with alcoholic liver disease. And also they found a decreased amount of bile acids, which are important as antioxidants. So when you test your gut and you find that you have less of the beneficial bacteria, your provider can help you by giving you different products to help some of the beneficial bacteria grow by using maybe prebiotics, and if needed, probiotics also. So this study showed that in mice, zinc administration along with alcohol feeding restored the alcohol-induced gut dysfunction, and that the use of probiotics such as VSL3 or Lactobacillus rhamnosus improved the microbiome imbalance and improved gut permeability. And here are some ongoing studies looking at the use of probiotics for patients with liver cirrhosis and alcoholic liver disease. And this study showed that in some patients with cirrhosis, they found not only a reduced amount of Bacteroidetes and Firmicutes bacteria, which are usually commonly found in the gut microbiome, they also found increased levels of bacteria that's usually found in the mouth. And this study felt that some of these bacteria that usually live in the mouth are now in the gut could be related to patients getting cirrhosis. And their conclusion was that a diverse gut microbiome is associated with a lower risk for cirrhosis progression and a reduced risk of hospitalization. So as I discussed earlier, it's very, very important to have a good gut microbiome, to have the right amounts of good bacteria and lower amounts of the not so good bacteria. And so the way you do that is by having a very good diet, by taking prebiotics if needed, and appropriate probiotics. It's also important to get rid of the really bad bacteria by using maybe antibiotics or herbal antimicrobials. And also it's important to repair the gut lining. I think we talked about it in the previous presentation, where if your gut lining is not really completely intact, you can have something called a leaky gut. So you can work with your practitioner to improve your overall gut function. This is really important. If you're going to improve your liver, you've got to improve your gut. So we talked about different ways of reducing harm from alcohol-associated liver disease. We know that decreasing alcohol use is one of the best ways. Improving nutrition is very, very important. And again, when we talk about improving nutrition, we're talking about whole foods, plant-based diet, avoiding sugar, avoiding processed foods, and maybe using enzymes to help you digest your food. But it's really important to do functional medicine testing to see what your deficiencies might be. And then depending on your deficiencies, or if you have too much of something, you may want to take targeted nutrients and supplements. You want to make sure if you're using some of the herbal products that we discussed, that they're really good. It's easy to get any herbal product, but we don't know if you're getting the right amount and the right quality of these products. It's essential to do gut microbiome testing and treat your gut appropriately, not only for improving your liver function, but also improving your brain function. So healing the gut with appropriate prebiotics, probiotics is very, very important. Of course, there are also other foundational things you need to do, like decreasing stress, improving sleep, exercise, perhaps seeing a therapist. All of those are very, very important. But in this presentation, we're just talking about how to reduce the harm to the liver from the use of alcohol. I hope this presentation was useful for you. If you need to contact me, you can go to my website, which is called brainbodymedical.com. I'm Dr. Madhava. I also have a Facebook page that's called Integrative Addiction Medicine at Brain Body Medical. Thank you so much for listening.